Leslie Dock, and I'm the founder and chair of Protect Our Care. And I was the senior counselor to the Secretary of the Department of Health and Human Services for the last several years of the Obama administration. I want to thank you for joining this call. I'm going to make some quick introductory remarks and then turn the call over to our two distinguished speakers, and then turn it over to all of you for some questions. We're here to talk today about the deep racial inequities in healthcare that are plaguing this country and that have been laid bare during this pandemic. And both of our speakers have been not only healthcare champions throughout their careers in Congress, but also have been champions on this particular issue and have together introduced a bill, the Omnibus Bill of 2021, that directly looks at how we can help mothers and families survive this pandemic and get the health care and additional supports that they need in food and in the economy and other kinds of assistance to be sure that they lead a healthy and long life. Today, we are also releasing a Protect Our Care, a report about how the pandemic has taken a particular strike at Black families. It's called Crisis Within a Crisis, how the pandemic has taken a disproportionate health, economic, and social toll on Black Americans. And I just want to start us off with sort of three statistics from that report. Black people have died from the coronavirus at almost 1.5 times the rate of white people. And shockingly, 1 in every 645 Black people in the United States has died from COVID-19. Unemployment amongst Black workers is about 50% higher than for white workers. And despite the fact that they have been disproportionately affected by the virus, Black Americans received just 5.4% of the administered vaccine doses during the first month of vaccinations. It was communities of color that suffered the most from the efforts by Republicans to sabotage and destroy the Affordable Care Act over the last 4 years. And they are suffering the most and the hardest from this pandemic. We're here today to talk about the actions President Biden and Congress are taking already through the American Rescue Plan and the other actions that are needed that are embodied in the Omnibus Bill. As I mentioned, I'm joined today by two healthcare champions, by Senator Cory Booker from New Jersey. Senator Booker, throughout his time in the Senate, has been a leader in the fight to make healthcare a right in America, not just a privilege, and to increase access to care and lower costs for millions of Americans. And he's been one of the Senate's strongest proponents for health equity. And we are also joined by Representative Lauren Underwood from the 14th District of Illinois, who was just reelected to her second term and is already one of Congress's greatest healthcare champions, and who I had the privilege of working with when we were both at HHS. As I mentioned, Senator Booker and Representative Underwood have introduced the Black Maternal Health Omnibus Bill of 2021 that makes critical investments in the social determinants of health that so deeply influence maternal health outcomes and family outcomes in underserved communities, including investments in housing and transportation, nutrition, and healthcare. They'll describe this bill and its important role, as well as their other ongoing efforts to address these historic inequities. I'll now hand it over to Senator Booker, but let me also quickly say that the senator, due to some late-breaking events in the Senate, will need to leave at the conclusion of his remarks, but Representative Underwood will be able to stay for questions. Thank you. Senator Booker.
I'm really grateful for that very generous introduction, and I'm grateful for the life of leadership and service on urgent issues that you've been leading. And so thank you for just being a brother in the cause, the larger cause of our country. And I cannot tell you what it means to me to be in partnership across the Capitol with Congresswoman Lauren Underwood. She is a remarkable leader in our nation, and in her short time in the United States Congress, she is someone who has earned a reputation as a real champion for expanding access up to quality health care for everyone. She is truly, in my opinion, one of the great rising stars of our country, and I'm honored to be in partnership with her on so many things. In fact, as was mentioned in the introduction, she dug in right away, combining her skills and acumen as a leader as well as her professional experience to help us to get a Black maternal health momnibus package, really a package of about 12 common sense bills that will save moms' lives and confront the deadly disparities that are just so unconscionable in a nation this great. Those disparities in maternal health care across maternal health care access and outcomes that is putting so many Black women at risk. Now, the unfortunate reality is that Protect Our Care has laid out really clearly what we know to be the challenge. This report is showing what people of color really know in their everyday lives, that we are facing multiple crises at once. A deadly disease that we know is disproportionately affecting and taking the lives of people of color, and a healthcare system so saddled and saturated with bias and that has historically really failed and continues to fail to serve people of color in this country. We are seeing that and an economic crisis that is exacerbating already existing inequalities and injustices in our nation. And so I'm grateful, really, that President Biden has a plan and has proposed really something at the scale that we need to confront this public health and economic crisis, and include things that I'm really excited about, like an expanded child tax credit that would slash the child poverty rate in America in half, and even more so for Black and Brown communities. We know we have much work to do, and we need to see bold action when it especially comes to earning the trust of communities of color in public health issues, making sure that we are directly confronting the understandable suspicions that communities of color have, given our history about vaccines, and that are going to face the challenges of really distributing this vaccine in communities of color. In so many ways, we know that we have in our communities incredible organizations that actually have built the trust. Communities that have organizations that they've been serving that can really empower us to overcome those hurdles of suspicion when it comes to vaccines. And I've seen this in my own city. I'm sitting here in Newark, New Jersey. In Newark, we have a great organization called the Newark Community Street Team, a violence prevention organization who shifted some of their work when COVID hit. And they've been going out into the community. They're trusted individuals, sharing information and resources about stopping the spread of COVID. And that's why Congresswoman, Robin Kelly and I introduced the Community Solutions for COVID-19 Act to empower community organizations to create and expand programs to eliminate inequities that are prevalent in healthcare outcomes due to COVID-19. And I'm really hopeful that something similar to it can be put into the stimulus package. And again, I'm grateful to have friends and partners in the President of the United States and the Vice President, Kamala Harris. Again, I want to thank Protect Our Care for their work. I come from a belief in the radical love that is necessary for our country to move forward. It is an understanding, as King said, that we are all caught in an inescapable network of mutuality, tied in one single garment of destiny, that injustice anywhere is a threat to justice everywhere. And to have such deep injustice, as Protect Our Care has pointed out, concentrated in communities, it is a cancer on the body of our country that threatens us all. And so we have a long fight ahead of us. We have work to do to confront this virus, to share accurate, critical public health information, to distribute the vaccine to everyone, because you cannot stop a pandemic anywhere unless you confront it everywhere. But I am hopeful, because of the leadership of those on this call, that we will make it through this crisis, that weeping may endure through this long, dark night, but joy will come in the morning. But today, we must reimagine public health as a nation, not just to make it through this crisis, but to achieve the long yearned for justices that our country must make real. It is not enough to say we are a nation of liberty and justice for all. We must do the work to bend the arc of the moral universe to make justice real for every American. So thank you.
Thank you. Thank you for all you do, all you've done, and all you will do to help us solve this crisis. And let me now turn over to Representative Underwood.
Well, thank you, Leslie, for having me. And I always hate having to follow Senator Booker. I don't have any kind of poetry like we must build the arc towards justice. But what I can tell you is it's an honor to do this work with him every day. On Monday, my home state of Illinois reached the grave milestone of 20,000 COVID-19 deaths. I'm thinking of the families of each of our neighbors who we've lost. I'm thinking of everyone in our community who's currently suffering from the physical and psychological and financial consequences of the pandemic. This past year has been so hard for so many of us, and it's not over. We still have a long way to go until our family's health and economic well-being is secure. And as the new report from Protect Our Care and the Coronavirus War Room illuminates, the impacts of this pandemic have hit communities of color the hardest, particularly African Americans. The stark racial disparities in COVID-19 outcomes exacerbate underlying inequities that predated the spread of this virus in the United States. Long-standing health disparities driven by structural racism and disparate levels of access to healthcare are driving disproportionate levels of severe illness and death and lower vaccination rates within the Black community. We need to take bold and targeted action to make the investments that will be needed to not only end the pandemic, but also rebuild our healthcare system and public health infrastructure on a foundation of equity. The good news is that the Biden administration is laser focused on ramping up vaccine distribution with a particular focus on communities that have historically low vaccination rates. Congress also needs to act. The next relief bill must include significant funding to accelerate vaccine administration with a particular focus on providing vaccine doses and outreach to ensure that nobody gets left behind. We also need to fund the workforce that will carry out vaccination efforts, as well as testing, contact tracing, and other critical initiatives to stop the spread of the virus. I've introduced two bills, the Community Immunity During COVID-19 Act and the Health Force, Resilience Force, and Jobs to Fight COVID-19 Act, to make the investments that will be needed to end the pandemic, prevent the next public health crisis, and ensure a strong economic recovery in every American community. And finally, as we continue to confront a once-in-a-century health crisis, it is absolutely unacceptable that millions of Americans continue to lack access to affordable health care. President Biden's decision to open a special enrollment period, which is open right now through May 15th, is an important step to ensuring that people can get covered. But we also need to ensure that when people go to pick out their plans, they find options that are affordable for themselves and their families. And that's why I introduced HR 369, the Healthcare Affordability Act, which would increase the dollar amount of premium tax credits across all income levels. It would eliminate premiums for lower income households. It would reduce premium costs by hundreds or thousands of dollars for middle-class families, including those who make too much money to qualify for a tax credit. And my bill would ensure that everyone will be able to buy a plan for no more than 8.5% of their income. So for families in my Northern Illinois community who currently pay 15, 18, or 20% of their income on healthcare, we're talking about real savings that matters. This policy was included in the President's American Rescue Plan, and the Ways and Means Committee recently advanced legislation that would expand eligibility for premium tax credits to people with incomes above 400% of the federal poverty line for 2021 and 2022. And it would expand the size of the tax credits during those years for households with income below 400% of the poverty line. For households with incomes up to 150% of the FPL, marketplace premiums would be eliminated. And FPL, federal poverty line. Okay, good. It's critical that these Healthcare Affordability Act provisions are included in the COVID-19 relief package. At this challenging moment in history, the decisions we make will be felt for generations. If our ideas are too small, the consequences will not only mean a protracted pandemic, but also a stunted economic recovery. But if we pursue solutions that meet this moment, we can not only get to the other side of the pandemic, but we can emerge from it stronger than before with evidence-based public health investments that prevent future crises, with career pathways that usher in a new era of economic growth, and with a healthcare system built on a foundation of equity, where access to care is not only the privilege of a few, but the right of all. I believe that this future is possible, and I know that the decisions that we make today will shape it. I look forward to partnering with Senator Booker and other healthcare champions to do the work of our constituents that they sent us to Congress to do. Thank you.
Thank you. Your constituents made a wise choice. And we're happy that you're here. We also thank Senator Booker, knowing he had to leave early. I just want to first let press on the line know that we're about to go to questions. And so if folks go to their chat function and raise their hand, my colleague Brian Doherty will get people in the queue. I just want to close with 2 points that, and to reiterate, first is that the American Rescue Plan has critical provisions that will address these disparities and make a dramatic difference for communities of color. They include Representative Underwood's bill that'll make healthcare more affordable to millions of Americans and get more people covered. It includes provisions to be sure that those states who have refused to expand Medicaid have greater incentives to do so, which could mean 4 to 6 million people are covered, could get covered, including 60% of those would be people of color. It also includes money to be sure that and efforts to be sure that vaccines are distributed equitably, renter relief, increased unemployment insurance, just a number of critical measures. We need to pass that bill. We need to pass it quickly. And at the same time, we move forward on the other bills that are included in the omnibus package that our speakers have discussed. The other critical point to know is that these provisions are overwhelmingly supported by Americans of both parties, in red states and in blue states. And that really the opposition comes from ideological opposition from the Republican Party in Congress. They should support these measures just as their constituents do. We need them to become law. We need them to become law quickly. So with that, let me turn it over to Brian to take some questions.